This is the wrist and hand exam. I'm going to start by treating the radius and then treating the wrist and then also treating the flexor retinaculum for carpal tunnel and then the interosseous membrane. So starting with the radius, I will grab both wrists here and place my thumbs over the distal radius and then spring with his hands pronated and then have him flip his hands over and spring with him supinated. And it looks like he is restricted in supination of the right radius. So he has a right pronated radius, and in order to treat this, I would move his right arm into the barrier, which would be supination, until you reach the feather edge, and then have him push back against my resistance. And we do this for 3 to 5 seconds, 3 to 5 times. And then I would reassess, springing both in supination and in pronation. And we're looking for the restriction in supination to be resolved and for the wrist to supinate more freely. In order to explain this to the patient, I would say, I'm gonna have you stick your hand out with your palms up, and then I want you to try to push back against my force for 3 to 5 seconds, and we'll repeat 3 to 5 times. Next, I'm going to evaluate the wrists in both flexion and extension. And his right wrist is restricted in flexion, so he has a right extended wrist. So to treat this, I'm going to move his right wrist into flexion, have him push back against my force for 3 to 5 seconds, and we'll repeat this 3 to 5 times. And then I will reassess by flexing and extending the wrist, and we're looking for this right wrist to flex more freely after treatment. So to explain this to the patient, I would say, I'm going to have you bend your wrist, and I want you to push back against my hand. And we would do this for 5 seconds, repeat 3 to 5 times. And then next, I'll be looking for a restriction in the flexor retinaculum, and this will treat the patient if they do have carpal tunnel syndrome. I would check both sides, and he seems to be more restricted here on this left side. So in order to treat him with myofascial release, I would hold his left hand and place my thumbs over the flexor retinaculum and have him extend his wrist and then move my thumbs apart. And we would relax and repeat this 3 to 5 times. So to explain this to the patient, I would say, to help with the pain that you're experiencing from your carpal tunnel, I'm going to have you bend your wrist back, and I'm going to try to relieve some of the tightness and this covering that goes across the nerve in your wrist. And then finally, we can treat the interosseous membrane with myofascial release. So I would do this by trying to separate my thumbs over the membrane and then having the patient flex his wrist and then extend it. And we would move down and he would flex and extend. And we would do this 5 to 10 times. And then I would reassess by looking for improved or lessened restriction in the interosseous membrane. And to explain this to him, I would say that there's a sheet that connects both of these bones, and basically I'm trying to get it to relax and to pull that membrane apart so there's less restriction and the bones are freer to move in your arm.